Hi guys, it's Nurse Amanda here. I'm recording a quick video for you guys about school health emergencies. I thought it might be nice to receive an update in a different format. So if video is better for you, then feel free to watch along. This will probably be about 5 to 6 minutes long. I will be talking about different student emergency scenarios. I'll also be talking about what those things look like and what a cardiac arrest and drug overdose might look like. So if it's easier for you to just read through the slides, then feel free to do that. And I'm going to jump right in and share my screen. All right. So this is a presentation called School Health Emergencies or Health Emergencies in School, what school staff need to know. So in this presentation, we're going to cover what school staff need to know about student health emergencies, what some different types of student health emergencies might be and how do we manage them, what are some things that all staff can do to assist in the event of an emergency, what can you expect from your school nurse in the event of a health emergency, and what trainings could you do to learn more about health emergencies. All right, so here are some of the common student health emergencies. We would have anaphylaxis, which is an allergic reaction. It's a severe and systemic allergic reaction. It's most common when a student eats an allergen. It could also happen with bee stings. When you're talking about anaphylaxis, it's going to be multisystemic, so more than one body system is going to be involved. It's usually rapid and with obvious signs. If you have a student who has anaphylaxis in your classroom, then you also have an EpiPen for them. And by now, we've gone over all of our EpiPen trainings for all of our school staff. If you would like to go through an EpiPen training and competency with me, feel free to stop by the health office anytime. A school nurse or a staff who has been trained by the school nurse each year can administer epinephrine if it's needed. So if one of your students were to have anaphylaxis and you have been trained by me this year, then you would be able to give that epinephrine. Or if you are not trained, or if you prefer for me to give it, give me a call. Some other student health emergencies. So seizures, there are multiple kinds. Here are three of the most commonly described and classified. Tonic-clonic, which is like the upper arm, lower body shaking, loss of consciousness. Myoclonic and absence seizures. These will all look different depending on the seizure type. If you have a student who has a seizure disorder, then you and I will probably just review what their seizures normally look like and what kind of treatments they have available to them at school. We do have students who have emergency medications available for seizures if they are to have seizures in school. Only the school nurse can give those. Those are not medications that can be delegated. Choking. So this is most likely to occur in the cafeteria or during lunch or snack time. In the case of true choking, the student would not be able to make a sound, so they might be soundless. It's kind of tricky. You won't always see it. You might see a student making the sign, or they may be leaning forward. Leaning forward is an automatic reflex to try and put pressure on the abdomen and try to dislodge that thing that's stuck in the airway. Choking can be resolved by using the Heimlich maneuver or by doing chest thrusts when the student is down on the ground. And then we have hypoglycemic shock, and this is dangerously low blood sugar. So this would be common with students who have diabetes. It could also happen with people who are pregnant. Hypoglycemic shock, the student might pass out, might faint, might lose consciousness. They would probably be cold and clammy. They would have a rapid pulse. There would be a different change to the color of their skin. Cardiac arrest is when the heart either stops beating or is beating abnormally. Again, the student might lose consciousness or suddenly fall over. They may or may not have a pulse. Their breathing might change in response to the heart rate changing. If you witness somebody fall down and they don't seem to be conscious, they don't seem to be breathing, their heart rate doesn't seem to be correct, then you would be calling for the nurse. Anybody who is trained in CPR may administer CPR and may use an AED in school, but you have to have a current CPR card and a current CPR training. And that applies for choking as well. Choking would be if you've gone through a CPR or first aid training, then any staff member who has that training may administer. Our AED is stored on the outside of the gymnasium. And I check it every day to make sure that the battery light is blinking and that it is live and ready to use. And then a drug overdose. So, with a true drug overdose, not just overconsumption of narcotics, there would be respiratory compromise. So, the breathing pattern would be changed or would be shallow. There would also be fixed and very small pupils. The pulse might be rapid or might have started to slow in response. The person may have vomited. They may or may not be breathing with a drug overdose. And only a nurse can treat a drug overdose. And I do have the emergency rescue medication, naloxone, that is locked in the medication cabinet if we were to experience that in our school. All right, so what can all staff do in the case of emergency? So the first thing is to alert the nursing office. You call over the walkie-talkie, let me know what's going on. Nurse Amanda, we have a health emergency in the cafeteria or on the playground. Tell me where you are. A student seems to be experiencing anaphylaxis. Try to briefly describe what is happening so I can grab what I need when I come. I might ask you what the student's name is if I'm going to be grabbing medications for them. So if you think a student's having a seizure, I might ask you their name because I might have a medication for them. If you don't have a walkie-talkie, then you can send the nearest staff member to the main office. You can call on the line down to the main office. Another thing that all staff members can do is to clear the surrounding area of other students, calmly directing them out of the room. And another thing that you can do is to speak loudly and calmly about what you see and what you are doing. So saying, I see this student seems to be having trouble breathing. Even just saying something like that out loud helps key in the other staff members or the other people in the room to kind of notice what is happening. And it also helps to orient you and kind of put your feet on the ground and put you back into that room. Because usually in emergencies, time seems to either go really fast or really slow. So speak clearly, speak out loud about what you see and what you're doing. If you're on a field trip and you see or experience any of these emergencies, you'll be calling 911 directly. All right. And when we call 911 about any of the student emergencies that I've mentioned above, we would be asking for advanced life support. Okay. And in the event that any student must be transported to the emergency room without a parent or guardian present, a school staff member has to accompany them to the emergency room until the parent or guardian arrives. So sometimes this would be the school nurse. Sometimes it's a member of the administrative or teaching team. We try to transport kids with somebody who knows them the best or with somebody who knows the situation the best so we can give a better report to the people who are taking over their care and to the parents when they arrive. What can you expect from your school nurse? So, in the event of a student health emergency in the school building, you could expect me to arrive at the scene within 3 to 5 minutes. I wear my running shoes when I come to work. You can expect that I would ask and delegate tasks to surrounding staff members. So, I would ask somebody, can you write down the time? Can you take notes about what I'm saying out loud? Can you please clear the room of students? Please call 911. Put the operator on speakerphone. Please ask Mrs. Cruz to print the student's emergency contact sheet or something like that. You could expect that I'll provide students or staff with emergency care, including administering medications. And you can expect that I would provide a report of the student's health condition to any emergency medical personnel that arrive in the building. And you could expect that I will debrief with staff who were present at the time of the school health emergency after the event that has resolved. So I'm going to publish these slides to everybody with this email, and I'm going to include some different links for different trainings for some of these school health emergencies. Many of these trainings are free. So anaphylaxis training that's put on through FAIR, well, it says Chrome from FAIR, which is food allergy and something epinephrine. I'm going to let you know about that. Food allergy education, something education, resources and education is in the first link. And you can register for the course called Save a Life, Recognizing and Responding to Food Allergies for free. It's a video training. And then there's a seizure training from the Epilepsy Foundation that is also a free training. CPR, first aid, and AED training is not free. They are for paid registration, but if you are interested in taking one of these courses, please ask your HR representative about having it reimbursed. Do you think it's valuable training for everybody who works with kids? And then there is a webpage that I published to you guys about recognizing an overdose and how to differentiate between somebody who's taken too much of a substance and somebody who is having a true overdose. And that's the end of my presentation. Thank you so much for watching this video. Like I said, I will publish the slides and I will include it with the email. Thank you so much.